Harihi Guru Brahma Guru Vishnu Guru Devo Maheswara Guru Sakshat Param Brahma Tasmai Shri Gurave Namaha. Namaskaram, Master. My salutations to the lotus feet of all the homeopathy teachers, guides, masters, and my salutations to Master Ike Garu, Dr. Chalpati Garu, and my pranams to Dr. B.V. Satyanarayana Garu, who has provided me this opportunity to speak to you, and my dear friends. A good evening to all of you. We have been discussing medorrhinum last Wednesday, and there was a power failure, and the class was abruptly closed after 47 minutes. We will continue the class. Last time I told the last sentence was the pain in the right medorrhinum, and also there will be numbness in the limbs. Then the medorrhinum also has rheumatic pains, and the skin is yellowish. Somewhere you find this symptom in Merxal also, and copper colored spots on the skin. This you will find in cuprometallicum, copper colored spots on the skin. The patient is sleepy. He will be getting yawning, but he will not get sleep, cannot sleep, and he will get sleep in the towards the early morning. That you find in Naxwamika. So you see the symptoms of various drugs in one drug, and this is being the king of the psychosis. Like we say, Tuja is one of the psychotic drugs, and this competes with the Tuja in all respects. And great restlessness at night, you will not sleep well, you will be tossing in the bed, and dreams of ghosts and dead people. You will be getting dreams of ghosts and dead people. So all these symptoms, in fact, these are the consequent to the suppression of the gonorrhea symptoms, and gonorrhea is the main cause of the medorrhinum. And deep-seated chronic effects of the spinal cord and the sympathetic nervous system. This you can see in many people where the spinal cord is affected, and after that, slowly the symptoms have developed. Medorrhinum you can think of. This is one of the very deep-acting medicines, and symptoms of nervous system, symptoms of brain, and the skin is involved, brain is involved. All the drugs, almost all the organs are involved in medorrhinum. That please remember this very important point. And cardiovascular problems or respiratory problems, rheumatia can be thought of, and joint pains are there, rheumatism is there. That is also one of the very symptoms, important symptoms of medorrhinum. And there will be enlargement of glands, enlargement tonsils, enlarged adenoids, enlarged thyroid, enlargement something. They will be telling some enlargement of glands are there. And patient is weak, patient is fatigued, and there is emaciation of the patient. They will become very, very lean. That is one symptom. And as I told you, weeping disposition is there. Disposes to weep. He weeps. Even male members, they weep while telling the symptoms. The patient is a bit irritable, peevish, and he does not have patience, impatient. That is one symptom. And he is affected by heat. So he wants cold applications. He is affected by heat, heart patient, and soreness of all over the body, and especially the glands, I told you, with the burning in the hands and feet. And this is also one of the very good medicines for profound exhaustion. Patient is totally weak. You will find in arsenic album. This is one symptom. A condition of collapse and always wants fan. This you will find in Karbovich. Karbovich patient always wants fan. and collapse state. Carbohydrate is called the corpse reviver also. In such cases, it will work. And there is coldness all over the body, but does not like to be covered. Though he is cold, he does not want to be covered. And cold and bathed with perspiration. The sweating is so much that he gets wet in the perspiration. You will find this in calcare, one symptom. And this a craving for liquor is there. This, of course, you cannot take it as a common symptom in all, because those who are not habituated of taking liquor, if you ask, do you drink, means they'll say no. That you cannot take it as a symptom. Those who are habituated for taking drink, you can ask. And there is craving for salt, there is craving for sweet, there is craving for acid. That is why I told yesterday that later drinks like Pepsi or Coca-Cola, these things they like much. And the symptoms are better. The backache is better by profuse urination. When he passes the urine, he feels much better. So, passage of urine relieves him from many symptoms. So, that is there. And nowadays, you will find women with PCOD. So, the medorrhinum has PCOD symptom also. And there will be inflammation of ovaries, fibroids are there, cysts will be there, and morbid growth of this uterus is there. And sometimes the uterus may have even cancer also. This is one of the medicines for cancerous uterus also. And there is general aggravation from sunrise to sunset. The symptoms aggravate from sunrise to sunset. Hence, medorrhinum we recommend to give night before going to bed. It is better always we give medorrhinum. And they told you yesterday, I repeat again, the weakness of the memory. He forgets names, even he forgets his own name in very serious case, critical case. And he is very much worried about this forgetfulness. He will come and tell, sir, nowadays I am not able to remember. So please, I am only forgetting everything. Do you have a medicine for that? They will ask. And this medorrhinum is one of the best remedies for such. So that you remember this, very important. And next, forgets the friend's name and predicts the future events correctly. This is the one symptom, peculiar symptom the medorrhinum is having. He will get a dream that somebody is dying. Then after some days, that person will die. He thinks that because he has dreamt it, he died. No, he will get some extra sensory perception. It is clear audience and clairvoyance he will be having one. We have got cannabis indica, many other drugs are there for it. So this is one symptom. Remember that any case, person who is maltreated or suppressed gonorrhea, the best selected remedies also, when they fail, medorrhinum you can think of. Sometimes we put all our efforts to find out a remedy and medicine is given, but it doesn't show the required result. In that case, one dose of medorrhinum in 200 or 1 potency will solve the issue. And there is trembling all over the body with intense nervousness and profound exhaustion. There is trembling of the body. This you will find in many cases where the gonorrhea is suppressed. Patient will have this symptom. And the another important symptom, like I told you, camphor and Sekelkar, the patient does not want covering, but cold and bathed with perspiration. And one important symptom, sensation of tightness, constriction, and soreness all over the body. All over the body as if it is beaten like anything. So that soreness of the all over body is there. And intense restlessness. In a state of restlessness, very serious restlessness is there. And the dyspnea is relieved by lying on face and protruding the tongue. This is another peculiar symptom of medorrhinum. There the patient sits like this, puts the head into the pillow, and When that, if you do like that, he will be better by the dyspnea, that is asthmatic upasam, we call it as, that can be relieved. And burning of hands and feet is one of the very important symptom. Burnings of hands and feet. This generally you will find in cases where diabetic neuropathy is there. This symptom will be there, and he will not cover the hands and feet, and then this way he will cover from above the feet. So like sulfur, keep the feet out of the bed, and pain in the heart region. That is one symptom he will tell. And another important point is, in case of women, there may be chronic inflammation of uterus. Then there is a problem of cellulitis. You will see nowadays the cells they inflame. This is one of the medicines for fibroids, cysts. And another important symptom is cannot spell correctly, even very common words. Spelling is wrong. I told you the jumbling, this side, that side. So even the common names also you will not be able to spell properly. Always has a weeping tendency, and there is another that is important symptom we already discussed. I am just again refreshing because 1 week back we discussed, and always anticipates something. Anticipation is there. Even anticipates their own death. Medorrhinum patient anticipates, I'm going to die, like that. It's too much irritated by very silly matters. It's not the important symptom. We feel that that matter is not that important, but for him, it is very, very important. Here, the logical brain is not working. We'll be surprised to see people worrying about the small things, trivial things, which does not carry any value. But for them, it is something very serious. This is one symptom present in medorrhinum, and is very anxious, sensitive, nervous, fastidious, like arsenic album. He wants everything in order, worried about the cleanliness. He asks everybody to keep it clean, and time passes very slowly. This symptom you will find in alumina, argentonatricum, and cannabis also. This time passes slowly. That symptom is available there. Those drugs also wants to do everything in a hurry and then gets exhausted and fatigued. This is one symptom you will find in argentonatricum. Argentonatricum also always wants us things to do in a very hurried manner. Come on, fast, fast, fast. And the more he puts his energy there, he gets fatigued or exhausted, and the symptoms he will tell. He will not do it slowly, very fast, nature. And dreams of urinating you will find in Lacacannum. The drugs are there. But here, because of the insatiable thirst is so much, he drinks too many liquids, I told you last week. So he is getting even dreams of drinking water or cool drink, something like that. He will tell that. And many of the mental symptoms are aggravated when thinking about them. When he thinks of the symptoms are aggravated. This is one symptom is there in medorrhinum. And very important point is diseases of spinal cords, I told you. That is one important symptom. Sometimes the patient may end up with paralysis also. So even paralytic patients having these symptoms, always the system has only one principle called totality of symptoms. If that is there, for majority of symptoms tally with the medorrhinum, you can definitely give medorrhinum. Okay, that is. And there is a sensation of headache. Head feels very heavy, very heavy. It feels very heavy and is drawn backward like this. Head is drawn backward. So there is the two drugs, cholesynthesis and dioscoria. Stomach pain is there. Cholesynthesis stomach pain is better by bending forward. You will press the stomach like this. Whereas dioscoria is better by bending backward. So this is one of the very important modality. of cholecystitis and diascoria. Diascoria is better by bending backward. Cholecystitis is better by bending forward. This you should remember this symptom. And there is intense burning pain in the brain, which extends down the spine. So there is intense burning pain in the brain, and there is the pain radius down to spine, and headache is aggravated by uh, traveling in a car, jarring position, downward position. The headache is aggravated, and ravenous hunger immediately after eating. He wants something to eat after finishing the food. This is there in Sina, this is there in Lycopodium, and this is there in Sorinum also. This is one of the important symptoms with intense thirst, and there is intense craving for liquor, I told you, and also sweets and other things I told you. There is a construction of inertia of bowels with a ball-like stool. So this is like constipation. Ball-like stools it is. They can pass stools only by leaning far backwards. The constipation is better by leaning far backwards. Then you will be able to pass the stools. This is one symptom. And there is a sharp needle-like pain in rectum. Sharp needle-like pain in rectum, so as to cause crying and tears. The pain is so intense that he cries and tears come. This is the one symptom. And there may also be sensation of rectum prolapse is there. That is one symptom he may have. And stool is tenacious, clay-like, sluggish, with oozing of fetid moisture, and very intense itching of the hand. This you will find in case of the um, piles complaint. Many people will have this intense itching of anus. There is severe back pain extending from occipital region in the whole length of spine, which is very sore and sensitive to touch. Besides, there may also be a burning heat along the course of spine, beginning in nape of the neck and then extending downwards. This is one symptom. There is a pain in sacrum region and coccyx and back of hip running around. And pains are aggravated when thinking of them and by heat and better by cold. This is one symptom. And throat also, medorrhinum has many symptoms. In any kind of throat affection, remedy, there is sensation as if cold had settled in the throat and distressing pain and soreness in the throat. This is for throat pain also. This is one of the very good remedies. Of course, we have to see the totality without any doubt. And throat is filled with thick gray blood stained mucus. Mucus will come, there will be a stain of blood is there. The patient cannot swallow during this throat pain. He cannot swallow either liquid or solid. Take Ignatia, they can swallow solids easily than liquid. Liquid is difficult. So, but here both liquids and solids, the medorrhinum patient will not be able to swallow. This is one symptom. And there is something constriction in the throat. There is some constriction is there. The patient feels that there is constriction in throat. And cough is dry, continuous. Deep cough is there, hollow, like coughing in a barrel, as if he's coughing from a barrel. That is there in Lycopodium also. This symptom is there in Lycopodium. And difficult to raise the sputum. If at all raised, it is small, frothy, green in bitter balls and viscid. And the any asthmatic patient, because of suppression of gonorrhea, you can think of a medorrhinum. This is one of the best remedies. And larynx is completely stopped so that no air can enter. Breathing also very difficult. Can inspire well, but expiration is difficult. You can take breathe in, breathing out difficult. And the modality is better. The symptoms are better by lying on the face, protruding the tongue and lying on abdomen. And the symptoms are better in seashore. Symptoms are better in seashore. And aggravation, of course, when thinking of the problem, aggravation is there. And the surface of the body becomes cold and clammy, yet the patient does not like to cover the body and wants to be fanned. This is the medorrhinum patient wants fan. This is one of the very important symptoms. And for menstrual symptoms for female, it is either in meteorrhagia or menorrhagia. It is either profuse menses or scanty menses. This remedy is can be thought of when suppression of gonorrhea is there, or there is a profuse quantity, sometimes long lasting and very dark, clotted, offensive, stains the clothes and difficult to wash. This is one important symptom. Stain is so impressive that it sticks to the cloth. It is very difficult to wash it. And breast or nipples are very painful and sensitive. So to touch region, breast especially, nipples are icy cold. This is one symptom. Patient can tell the peculiar symptom. The nipples and breasts are icy cold to touch during menstruation, while the rest of the body is warm. So only the breast region is very cold. This is one peculiar symptom. And of course, urinary symptoms are there. Is the pain in renal colic, that is renal pain is there, and there is intense pain in ureter with sensation of passing some stone. Renal stones may be there in this case also, but as if pain will be so severe, as if he's sending out the stone. This is there in Lycoberibris vulgaris and Sarsaparilla. And urinating, there is painful tenuousness of the bladder. The pain will be there. And the children do bedwetting. This is one symptom. History of gonorrhea of the parents. I told you, the parents, if they don't take care of their health and they conceive, the woman conceives, then all the miasms will be inherited. This is the problem. This is coming because of the lack of awareness of homeopathy system. We have proved it again and again. Hahnemann has proved it again and again. Any persons who get married, first they have to go through the miasmatic treatment. What miasms they have? They will be having some symptoms. Because of the lack of knowledge of the homeopathy system, they don't know that homeo can even cure the miasms. They need not be transmitted to the next generation. The parents have a lot of responsibility of taking medicines for themselves before they conceive. I've been conducting classes, 4 classes I conducted, how to plan for a child. A child will not become sick by birth. When within 2 years or 3 years, the children are becoming sick, there is no meaning in that. Why? Because he has not done anything bad. He has not done any bad karma. He has not taken food that makes him sick. He has not spoken a word that makes him sick. Why the children are becoming sick? Because the history of the parents. Simply, they conceive, they get birth to the child, and he gets some problems, and he will say that, sir, what to do, sir, how to do, sir, this and my child is getting frequently cold and cough, sir. There is a tubercular miasm is there. The father will be sora and wife will be psychosis, and suppression of gonorrheal symptoms are there in 7 generations, I'm telling you. Even great grandfather has done something, then the third, fourth generation also may get the symptoms. This is homeopathy only can tell this. No other system can tell this. Can you imagine the grandfather has done some sin and this boy by birth is a patient? It will be surprising. But if the woman takes the medicine during conception and before conception, I'll tell you simply, we can prevent a number of infantile deaths. We can prevent. Then the childbirth deaths are when mothers die. All this can be solved. Homeopathy is to be adopted. Every day should think of homeopathy, dream of homeopathy. And all the government hospitals, private hospitals, everybody, all the MBBS doctors, MD doctors, Ayurvedic doctors, everybody should be taught the basics of homeopathy. We can do the holistic treatment. We can use homeopathy and allopathy and Ayurveda to the patient according to the requirement. And homeopathy is, I'll tell you, it's a wonderful system because we have been experiencing the sweetness of it. Of course, medicine itself is very sweet. We know the efficacy of this system, and many people do not know this. And nowadays, of course, there was some news item I have seen about 49% people are now adopting homeopathy. But what about 51 majority? They do not know what is homeopathy. Particularly in rural areas, so unpad log hai, those who are not literates, they do not know homeopathy. This is to be taken to those areas. And all the RMPs who are practicing in rural areas, they must be intense training in homeopathy. In fact, when I was in Anantapur, I proposed this. If we train the RMP doctors in homeopathy, instead of using some suppressive medicine in allopathy like painkiller or something, as a first dose, let them give homeopathy. I'll tell you more than 75 to 80% of the cases, it will be cured with the first dose. You know the basics of philosophy and the materia medica about 30, 40 drugs, if you know well, with the 12 tissue remedies, you can solve many cases. Of course, very deep acting miasm is there, and then we need to go over the totality, all those things. Of course, we have to study the system well. But in my opinion, if the RMPs at the rural medical practitioners who are doing practice at the rural places where allopathy also doctors, they do not enter those areas. Those people, in fact, those who are learning now through these classes, they can just think of this. If we can make them understand the system of homeopathy, let us train them. I am prepared to extend my training. The online training I can give to all. But we need somebody to just bring them together. And I'll tell you, if they adopt homeopathy, many problems will be solved. This is my sincere appeal to those who are attending these classes, if possible. And this is these are the symptoms of medorrhinum. We will just we have covered almost all the symptoms we have covered. And babies having psychotic background, there is a baby is dwarfish, there is no growth, very dwarfish baby with a stunted growth. This baby will see, suppose with a Sora background, we can think of Beretta with the psychotic background, we can think of medorrhinum to such babies. Mentally, the baby is very idiotic and physically also weak and pale. There is a enlargement of glands, and these are the symptoms we find in the medorrhinum. And medorrhinum is one of the very important drugs, I can say, because this will prevent the further passing of the, I can say that the miasmatic inheritance can be stopped. And it is one of the very important medicines, very important. And of course, we don't ignore this patient will never ignore. If anything is there, we will give the medorrhinum we frequently use in our regular dispensary. And this is the medorrhinum. Now we will close, and then we will go for the shyphilinum. Sir asked me to do shyphilinum and sorinum also, because there was a power failure and also some important points are missing. I would have covered this 15 minutes last week, but now we will continue with the shyphilinum. This is a very important nostril. Of course, nostrils all are important. This is one of the very important with some historical importance. This is introduced by Dr. Swan, SWAN. He is the doctor who have introduced this medicine, and the medicine is prepared from syphilitic discharge that is potentized. Of course, he has done it according to the condition. At present, it holds the place of king of anti-syphilitic. Syphilitic miasm, anti-syphilitic. This is one of the medicines, shyphilinum and Merxal. Merxal is also one of the very important anti-syphilitic medicines. Then Dr. Herring writes like this: no patient having syphilitic history in the past can be declared cured until and unless this nosode is administered at least once in the course of treatment. So, these nosodes, in fact, the importance is like that. Generally, what we do is methods of treatment. I have told you in my previous classes. When there is an acute complaints are there, we will select a medicine based on the totality of the acute. That we need not worry about the past history and other things, because the acute is that requires immediate treatment, and we give the medicine, and we can definitely treat with acute symptoms, and totality modalities are important. Then comes the chronic symptoms. The chronic miasm, chronic treatment, which is a very long-standing. Number one, chronic. The definition differs from chronic of homeopathy and chronic of allopathy. In allopathy, the chronic means it's a long-standing. For the last 10 years, 15 years, is suffering. They call it as chronic. But in homeopathy, it is not like that. In homeopathy, chronic means in spite of the best treatment given, if the medicine person is not responding, the medicine is not working, that means total cure is not attained. Such cases are called chronic cases. There is no complete cure, then chronic cases. For that, we need to take the inheritance and patient's history, past history, parents' history, then totality of symptoms, peculiar symptoms. All symptoms are important. Dreams are important. Then thermals, of course, modalities. This chronic treatment, generally, the people come to us, it is not serious, critical. In acute cases, there may be critical condition of the patient. For example, a patient who is having diarrhea of 20 times, 30 times, and total dehydration of the body, patient may collapse. In case of high fevers, the patient may collapse or go to epileptic attack, something like that. So they need to be attended immediately, and of course based on symptoms. Whereas in chronic case, the patient is okay but not healthy. Okay means he is able to manage the regular routine, attending office or a housewife, doing regular work, but she always complains that something is wrong with me. I am not okay. This is the chronic, very important point. They say, I am not okay. Or you are okay, you are doing all the work and you are taking so much, you are taking undertaking so much office work, this and that. I am doing, but I am not okay. This is a symptom of chronic cases. If they say that I am not okay and patient is okay, literally he is normal, but not okay, it requires chronic treatment. There you have to go through the patient, all the symptoms you have to see, and you need not hurry up. Immediately select some medicine and give it, it is not working, then change it, then it is working. Need not do that. Of course, the patient should have sufficient patience, and the doctor also should have patience. Then only patients will come. So, if such case comes to us with a chronic history, that means long pending, the long standing history, that is one point we take. Because why? Because he may come and tell me, sir, I have taken this medicine, that medicine, so many treatments I tried, sir, but not cured. So we need a chronic treatment, and their patient needs entire history of the case, and then we'll give. Then after giving the chronic treatment, patient feels better. I am okay, sir, but not totally okay. Something again it is coming. Again it is coming. Again it is coming. There are two reasons. Number one is patient may not be following diet restrictions. Number two, though it is a correct medicine, the cure is not complete unless you give one anti-miasmatic medicine. Then the third stage we call it as miasmatic treatment. There we go according to the symptoms of the miasm, and one dose of the strong miasmatic, anti-miasmatic drug is given. The patient is totally cured. So we need to, these three stages you have to observe. With all patients, you should observe these three stages. And there are some doctors who give all the three drugs at a time. One to immediately address the acute problem, the other as a constitutional, and also they give one miasmatic. That is not correct because stage by stage you have to clear out the symptoms. So by the time the chronicity of the patient, that is chronic symptoms are cured and again coming back, then we can think of one remedy that can answer totally. That is called the miasmatic remedy. So this is important. And any syphilitic patient having a syphilitic miasm, Dr. Herring says, unless you give a dose of the cure is not complete. So it works actually chiefly on the brain and spinal cord. You will see the syphilitic origin patients with spinal cord affections. Even the children will be spastic or will not be very strong. They can't sit and make the neck erect, but it will be always falling this side or side because there is no strength of the spine. This is one important symptom. And bone and periosteum, skin and mucous membranes also come under the spheres of actions of this remedy. And its action results in manifestation of various stages of syphilis in different organs, the nervous symptoms, brain and heart. And many the patient is generally copper colored, and there will be the skin will change to blue color, and nervous symptoms are there. Brain and heart are affected, and when he gets cold, the patient becomes blue, and the syphilis, the background will be syphilis. So whenever there is a history of syphilis in the patient or in the family, we can think of shyphilinum, that is the guiding symptom, and all the symptoms are worse at night. Even Nexal also is a syphilitic remedy, and symptoms are worse in the night from sunset. Medorrhinum you have seen. The symptoms are worse from sunrise to sunset, whereas in shyphilinum, it is sunset to sunrise. So night is the worst time for the syphilitic patients. Then pain increases and decreases gradually, shifting in nature, pain shift from place to place, and the patient requires frequent changes of position. With this, you can see in arsenical because of restlessness, patient sleeps on first keeping the head on the pillow, then he comes back and put the head on the left side, and constant change of position. This also requires frequent. This syphilitic patient, also syphilis patient, changes of position is there. And in women, syphilitic with syphilitic miasmatic symptoms, the women will have the profuse white discharge. This is one important symptom. There will be white discharge. I know some cases where white discharge is neglected. Even the patient has gone up to the cancerous state of the uterus. That is one important symptom. Please do not neglect the any person telling about white discharge. Please take care of it. And profuse white discharge. Too much white discharge is there, and soaking through napkin and running down the heels. So discharge is coming down instead of wearing the napkin. Also, it runs out, and then the symptoms are worst in the night. Another important symptom: the patient craves alcohol in some form. Whether alcohol he likes in some form. Of course, there may be hereditary tendency may be there in alcoholism also. This is one symptom. You need not worry about the persons who are not habituated to taking alcohol, and there will be a paralysis of superior oblique muscles of the eye. Eyes will be drooping. Eyes will. He tried to open it, but he can't open it. Automatically, half closed eyes will be there, and when you see him, you feel as if he's sleepy. And keeping the eyes closed like this, you feel as if the patient is sleepy. This is one of the symptom, and then drooping of lids is there. The lids falling down. That is one symptom, and another important organ of the syphilitic origin is teeth. Teeth gets decayed, and at the edges of gums and tooth, gets broken and edges are serrated and dwarfed in size and converges in the lips. At their tips, they converge at their tips. And this is one of the very important bones and teeth are affected in syphilitic origin patients. How to find the miasm also I'm trying to tell you because this is also important. You should know how to find out a miasm. The symptoms, if you see, you can find out. And I told you all the miasmatic the notes are to be given as the closing ceremony that you can give after giving the main medicine for the constitutional treatment. Give 1 or 2 doses of the miasmatic dose. Patient is totally cured. Of course, the permanency depends upon the patient's lifestyle and food habits. You cannot relax. Some people are asking me, sir, coffee I am taking, you ask me to stop. Can I take after the treatment is over? Yes, you can take. But if the symptoms recur, don't call me again. There is every possibility. Because it is a medicine. Why we ask you to avoid coffee, tea? They are all medicines. Medicines should not be taken as food. That is very little you have to take. That is the important symptom. And this is also important for syphilitic because of the dwarfishness. We call this. His dwarfish patient is not grown to the age required. A 12 years old boy may look like a 6 years boy. So the syphilitic origin is there. Parents, grandparents, great grandparents. This one is dwarfed in size and rheumatism of the shoulder, joints. That is one symptom. And another mild symptom, important symptom is memory loss. The patient will not have good memory. Medorrhinum also memory loss is there. But that memory loss is limited to the names. Very important, that is one. And spellings. But shyphilinum, memory loss in general. He is having very little memory and loses remembrance of the present occurrences, and he also cannot recollect the names, dates, persons, places. These are the things he also forgets. And very important point is the shyphilinum patient is very poor in mathematics. Even sometimes he feels like leaving the mathematics. I can't go to school. A fifth standard boy cannot do first standard maths. A 10th class person boy cannot do the fourth class mathematics because the comprehension is not there. If any teachers are attending these classes, if you find such children who are very poor in mathematics or comprehension, you can think of directing them to a remedy. You don't give, directing them to the nearest homeopathy dispensary, and you can tell the doctor sitting there that, sir, this boy is very poor in mathematics. Don't punish them by beating them, by asking them to stand in the sun. They don't learn. They require medicine. This you must remember. Even parents should not punish the child. Find out the right homeopathic remedy. Take them to homeopathy. This is true both in hyperactive and underactive children. Hyperactivity is also one of the disease symptom, and underactivity is also one of the symptoms. So don't beat them. It's my request to all of you. So arithmetical calculations are very difficult. He feels as if he's going to become insane. If you ask him 3 into 4 into 5 is equal to how much? Finish. A 10th class person also cannot answer. It is 60, very simple. Normal person also can tell. If you put a pressure on him, he feels that he becomes insane. He cannot solve the problem. So there is indifference, is there terrible dread of night on account of the mental and physical exhaustion on awakening. Night all symptoms aggravate. So night is approaching means the syphilinum patient will have lot of symptoms. Night is approaching. This is one of the very important symptoms, and it is intolerable, and he feels that it is better to die. I cannot pass this night. I let me that much suffering. He feels as if like that. It's a terrific suffering. He's having the fear. But that much suffering will not be there, of course, but it's one of the symptoms. And these are all because of the ailments from the syphilitic origin. So the shyphilinum also is because of the connection with illegal, that is a lady having some problem or a man having this VD venereal diseases. So such people will have this. And next very important symptom is that eye symptoms are there. So there is a problem and inflammation of the cornea is there, and especially in left eye. Next, there is intense sharp pulsating pain with intense photophobia, where you cannot see the light, bright light or sun. You cannot see, lids are swollen and they stick to during sleep. Furthermore, and there is a paralysis also, muzzle of the eye. This we see many paralysis of the muzzle of the answer. They always stay half closed eyes. So this is one of the shyphilinum is one of the remedies you can think of. And these symptoms aggravate, eye symptoms aggravate from 2 a.m. to 5 a.m. That is early morning. And better by cold application. You will be applying some cold application to the eyes. And headache is there. Headache also causation is sunstroke. When he goes out in a hot sun, he gets the headache and the excitement will come. Then the pain will be there across the temples and sensation as if her head would be crushed into pieces. This is one of the symptoms. Feeling as if with sense of weight and bursting in the vertex here, the mid of the head vertex. So bursting pain of the vertex and neuralgic pains are there with the shyphilinum and intolerable pain is there. Violent pain, the whole of the head with the face, the red color and enlarged veins and of the face, restlessness, sleepless at night. I told you, night is the aggravation period, hence you cannot sleep well. And pain in the eyes is there. Pain, the pain also increases gradually and decreases gradually. Pains frequently shifting pains is one of the symptoms we find in lacanum. Such drugs are there where the pain shift. And another important organ that is affected by disability is mouth. Mouth feels as if ulcerated. That is why Merxal is one of the best antiseptic drug. So the mouth ulceration blisters in the mouth, and then it is very, very difficult for him to take kara, something he cannot eat with the ulcers in the mouth, and deep cracks will be there running lengthwise on it. This is one symptom, ulceration of the tongue, lips, and buccal cavity, and edges are serrated and dwarfed in size. This is the mouth ulcers. Also, the pain is aggravated at nights, and of course, excessive saliva will be there. Even while sleeping, the pillow will be wet with saliva. That is the symptom for Merxal, and of course, syphilinum. That symptom is there. And next, constipation is one of the symptoms that syphilitic patient has, and he feels as if the rectum is tied with strictures. And another obstinate constipation for years together. Says that constipation is there for how long? He asks, oh, many years, sir. I've been suffering for last so many years. Rectums seem to be tied with strictures, and of course, chronic constipation with bad smell. Stool is light or dark colored, very, very bad smell. And it is as if the pains during labor, a woman will have pains. While passing stools, he will have so much pains. And the patient symptoms the aggravated by passing stools. This is one of the symptoms that he is having, the civilian patient is having. And there is a pain in the heart at night from base to apex, better at high altitude. and aggravation at seashore and at night. Night aggravation is a common, and of course, white discharge is one of the very important symptoms of shyphilinum, and very bad smell and profuse heavy white discharges. You can think of shyphilinum, and there is pain in the small of the back, and bones are affected. As I told you, teeth and bones are affected because of the syphilitic miasm, especially in the long bones, upper and lower extremities, with stiffness, severe pain will be there, and particularly the extremities, that is limbs, preventing sleep, and the caries is one of the decay. That is one of the symptoms of syphilinum, and these are all symptoms aggravated by hot application and better by cold applications, and sometimes warmth of bed at night, and he cannot bear extremes of cold and heat. Merxal already it was covered in our classes. The patient is sensitive to both the heat and cold. It is like thermometer. Thermometer can measure the temperature, so it is sensitive to both cold and heat. Merxal patient also is like that. He cannot bear extreme cold or extreme heat. Sensitive to both. This is the one symptom you can note down. And the symptoms are worst when the patient tries to sleep in the night. Night is the worst part for syphilis. And with the symptoms, like suppose you are given syphilitic origin is there, generally the symptoms when they come, we don't give nosode as the first dose. And nosode should not be repeated. Dr. PVS sir said, 1M potency, even 3-4 months it works. Same is the case with medorrhinum 1M or shyphilinum 1M. If you give for 3-4 months, you have to wait. Intercurrent remedies can be given depending upon the symptoms. Generally, when the patient comes with the syphilitic origin, the dwarfishness and then saliva from the mouth, the boy is very dull, weak, and bones are not properly growing, and there is a problem with the teeth, and everything you find Merxal is there. You can give Merxal, one dose 30 to 100, and in a very systematic way, there is an increase in the potency. You can go, and as long as the patient is telling better, need not repeat. Otherwise, once the work stops that particular potency, then you may have to repeat the potency. Then you may have to go to higher potency. After, in a very systematic way, after you treat the patient, if still the symptoms persist, then you have to think of the miasmatic medicine. That means an acute is over and a chronic is over. Now it is the time for us to select a miasmatic remedy. And if possible, we can discuss them again in other classes, where how to select a miasmatic remedy. And there are some constitutional medicines which are both constitutional and miasmatic. You take the sulfur. Sulfur is the anti-sore, king of the sora. So it works for both. Puja you take, the king of psychosis. Merxal you take. So they work as even the miasmatic medicine also. If still the patient is suffering or having the symptoms, that is, the symptoms are coming back. He says that, sir, still I am not okay, sir. Something is remaining. The patients come and very funnily, they tell, sir, 99.999% cured, sir. Why that 0.0001 is not cured? Then immediately we will think of the miasmatic remedy and give one nosode. The patient will be completely cured. This is the thing which you must learn. And if you can learn in this fashion, in this way, that how to treat the patient in a very systematic way, I will tell you, homeopathy is the solution to the health condition of the entire humanity of the world. We challenge any person with any problem, homeopathically can be cured. But suppose he's spoiled with too much medication of the other systems, cure may not be possible. That exceptions will always be there. Every rule will have an exception. And particularly those cases where they are working with other systems of medicine. Nowadays, I'll tell you, everybody is taking tons of medicines, not quintals, tons of medicines in a lifetime. Such cases, they become incurable because of the constant suppression of the complaints. Homeopathy always throws the complaints out. The vital force in us, it's a natural system. The vital force in us tries to throw it out, throw out. I gave you an example in the first classes, if you remember. By mistake, somebody swallows a fly through payasam or kheer. Unless it is omitted, the patient will never feel happy or better. But the nausea is so high that he has to vomit. And then in the vomiting, you will find a small fly. He can digest 1 kilo of chicken, but not 1 milligram or 2 milligrams fly because it is poison. The vital force in us brings all the force. Wherever is there, all the security persons are deployed there to see that this fly is sent. It is true with all chronic cases where the symptoms are driven out, and it is called the similar pathy. And what the vital force is trying to do, homeopathy also does the same thing by giving strength to the vital force. Whereas in allopathy is called the antipathy. It works in a negative direction. There is some skin complaint, they use ointment and suppresses it. There is some fever, they give some dolo or paracetamol and suppresses the fever. Antibiotics also, they suppress. They are not curative medicines. Whereas homeopathy, all medicines are curative medicines. That is why universally, if the homeopathy is adopted by each and every person, maybe that governments collapse. USA government, if they don't use allopathy, they don't keep allopathy alive, governments will collapse because so much billions of dollars of taxes are collected. And there everybody will be taking some medicine or other. Unfortunately, in India also we got those medicines. It is called English medicine. The Britishers we have introduced this English system. Nowadays, you will find everybody swallowing tablets, tons of tablets. Very unfortunate. And if we can give homeopathy to the pregnant ladies during the conception, the next generation will be very healthy. Imagine that all the pregnant ladies are given homeopathy, 9 months under homeopathy treatment. Take it granted, next generation will be a healthy generation. That's all. Maybe that those people who are very old, 70 years or 80 years, they may take allopathy for another 20 years or 15 years according to their age. They may die and allopathy also dies. I am stressing this in various forums and meetings. Wherever I meet the people, wherever I meet the doctors, I tell them, all the doctors, please learn. There are many MBBS, MD doctors who are my patients, and they have learned homeopathy and they are adopting homeopathy in their clinics and hospitals. There are doctors with open mind, of course. And another important point is psychiatry. The psychiatric medicines in allopathy, most of the medicines are suppressive medicines. They just make them sleep. Nowadays, of course, they started manufacturing drugs from the secretions of the brain, the hormonal secretions and other things. They have started. There is a constant progress. Development is there. But psychiatry system, homeopathy is the system to be adopted. You take the syphilitic child, there is no medicine in allopathy for such children. But in homeopathy, with this dwarfishness and other things, if you can select a right remedy which suits the totality of the patient, definitely patient is or cured patients. I cured many hyperactive cases, underactive cases with shyphilinum, tuberculum, and using medorrhinum. All these, in that case, no source are must. And the shyphilinum, the symptoms are aggravated in the night and twilight, that is Sandhya Samaya, and seashore, the symptoms are aggravated, and all the symptoms are better in high altitudes. So, those parents who are having the syphilitic children, please take a flat in either 10th floor or 20th floor in cities like Bangalore or Bombay. There, the patients feel better at high altitudes. So, this is we have finished medorrhinum and shyphilinum. And I thank you all, and I thank Dr. P.V. Satyanarayana garu. My pranams to him. He has given me this chance to speak to you. Thank you very much. Next week, we will discuss about sorinum. Thank you all.